Hello, everybody. This is Dr. Anjali Agarwal, consultant physiotherapist, lifestyle consultant, and heart manual facilitator. Today, the topic is role of physiotherapy in COVID-19. Having been trained in the UK in cardiopulmonary respiratory care, I bring in a very unique program to help with improving lung function. So we used to run this program in GP surgeries and would help patients with COPD, lung fibrosis, and pulmonary fibrosis to come out of their breathlessness, improve their quality of life, and improve their hospital and anxiety depression score. This program was introduced by me in India, also in the Hyderabad chapter, and we have helped quite a lot of patients improve their oxygen demands and also improve their quality of life. So I'll be talking in brief about what COVID-19 is doing to your lungs and about what you can do in acute care when you are at home, moderate, and also post your recovery. That's my introduction, a brief point of time. And what as individuals we can do is to have a circle of control within our framework. We have been panicking a lot with all the news coming, with all the data coming out. But if we know we have to take care of ourselves and we know how we will take care of ourselves, we have done our best to do what we need to do, what we as individuals are supposed to. Will take care of not overburdening the healthcare systems. We know there is shortage of beds and oxygen, but what we as individuals should do it that we should focus on eat healthy. So your lung needs good nutrition and a healthy lung needs good muscles. So definitely have your day starting with something which works on a diet, which will help your lung and help your muscles to grow strong. Limit the social media and also emphasize also on physical and social, uh, you know, uh, breathing exercises. Don't socialize and go on a vacation. Mindfulness and meditations are very important chapter for you. Positive thinking and gratitude also helps you develop these positive hormones, which will help you tide over the situation. Take all precautions and help others as well as possible. So talking about the 6-minute walk test or the dyspnea scale. Dyspnea is the breathlessness score. We know that COVID-19 sometimes can have a test result which is negative, and if it's positive also, we are telling people to monitor their pulse oximeter. What is a pulse oximeter? So we put up oxygen pulse oximeter on a finger and we see that how our SpO2 levels and how our heart rate is. We see it when it's been steady, when the lines are spiking up and it gets steady. That's the time we kind of stop recording it and we keep it down. But there is also a 6-minute walk test of SpO2, which is very, very important to do in the COVID-19. People who are not debilitated, who are not bedbound, they can put 2 points on the floor and about 50 feet apart, walk around it, and during the time of 6 minutes, see how the pulse oximeter is doing, whether it's falling 6 degrees. Suppose it is 98 and it just fall off to about 6 degrees. That means the lung is involved, and that is the time when we need to take urgent suggestion from our doctors or maybe visit a hospital or maybe needing a hospital admission. But before that, there are so many things that you should also look at. Whether the patient who's bedbound or something is able to utter a word. So you can ask them how you are doing. Are you fine? Ask them to complete a whole sentence. If they are kind of finding it very difficult to open their mouth and utter a whole sentence, that means there is a lung involvement. Look at their respiratory rate. Sometimes the SpO2 could be absolutely be fine and their respiratory rate just goes up. So that's again another point to see. And then the heart rate, and a heart rate going about 120, 130, 140, which is called tachycardia, can again be a signal that your lung is really trying hard to perfuse oxygen in various parts of the organs. Blood pressure shooting up, blood pressure falling down, these can be a vital sign to look for. So you should also have a blood pressure monitor at home. And your oxygen sats should be monitored maybe morning, afternoon, and dinner, but you should always do it not after eating your food, not after just getting up from sleep, because sometimes people have sleep apnea and their pulse oximeter or the oxygen sats would show wrong readings. And if you've eaten a heavy meal, your tummy would kind of press on your diaphragm and you will have wrong readings. So you understand when you got to take it, sit it in a comfortable manner, warm, rub your arms so that the blood flow is good in your fingers, then measure it. I prefer to do it from the middle finger, and that is good. A correct measurement, a correct reading gives us a lot of details. That's very important. Now, whenever we see that there is a COVID positive report or we've heard about news around, we start to pant and we start to do deep breathing. When you start to do fast breathing, you're using up all the oxygen and your body is full of carbon dioxide. As a result of that, you're hyperventilating. And because of hyperventilating, the body can go into acidosis, which will cause the difference of gaseous exchange between the lung parenchyma or thin alveolar sacs of the lung. So what I advise people, if you feel that you're panicking, if you feel your pulse oximeter is not showing the right details because of the panic, take a cup of imaginary cup. All of you might have smelled cocoa or chocolate in your life, a small child, an adult, a teenage, and an elderly person. So what do? Imagine that you have hot chocolate in it, smell the aroma of the hot chocolate, breathe in, and as you imagine, just shallow breathe into the cup. Imagine you are trying to cool down the drink of hot chocolate. This has helped to calm, and it's very mindfully proven that this has helped a lot of people to come out of a panic attack, which might have led into a hyperventilatory cycle. And whenever your lung is involved, which is your basal segment of the lung, or when you have pneumonia, you tend to hyperventilate. And that is again another reason for the gaseous exchange to not have proper patterns of breathing. Uh, Now we are talking a lot on awake prone lining. Physiotherapists all around the world and myself, we have done it from the time we graduated out of our school, physiotherapy school, and they were like used in postural drainage techniques. And this is like a lifeline for most of us. And where we have used these techniques to let the phlegm come out of their chest if there has been a lung disorder. And a very simple technique where you use a pillow, put it under your base of your legs, one pillow near the pelvic and one pillow over the chest, and you lie on your tummy. You could do it for 30 minutes continuously for 2 hours, and then you can switch into a situation of lying onto side, and then you lie onto left and to the right. Go back to sitting into a semi-reclined position, about 45-degree angle, with pop up your body with pillows at the back, and then again go back to lying on the tummy. By doing this, you'll not have fatigue by continuously lying on your tummy, because sometimes people will have issues lying on the tummy because they go more the tummy circumference, or they have problems lying on the tummy. But 16 hours at a stretch a person does, we have found that the lung perfusion or the oxygen sats can start to go up. So if somebody's oxygen sats are falling about 88 or so, we do them into prone, we see that it is improved about 4 to 5 degrees. By this, we have been able to save a lot of life staying in the house without needing the need to rush to the hospital too. So it is very proven, and all around the world, physiotherapists have been practicing it on the patients. Remember, this is a technique which was used by respiratory physios, by intervenists, and by pulmonologists. It is not a thing which has been advocated by YouTube channels and WhatsApp media and WhatsApp universities. Please consult a proper physiotherapist who knows about these techniques and makes you do it in front of them. Then you understand how well this can be done and how well you can save yourself. Okay, so every second is important for a person who is out of breath and having his oxygens less. So it's important that we do the right thing, which is more scientifically done by a trained professional like physiotherapist. So that was the acute care which I caused you, which is home. And now we come to the hospital setting where the ICU breaths we talk about in COVID-19 is 1, 2, 3, 4. So we will be taking about 6 deep breaths, and I will tell you how to do that. So you take in a deep breath through your nose, and you store it in your lungs. Imagine you're holding it like a bag, okay? A bag, your lung is like a bag and you're holding, absorbing that breath in your bag. Count off about 5. And then you exhale out. So when you exhale out, you imagine that there's a candle in front of you and you're trying to blow off the candle, but the candle flame shouldn't go off. It shouldn't be a very hard breath out, okay? So I'll repeat this 6 times, okay? This is my 3rd breath. Hold 5. This is my 4th breath. Hold 5 and exhale out. This is my 5th breath. Now on the 6th breath, that is important. Hold 5. Instead of exhaling, I cough. Okay, so this techniques, physiotherapists around the world, we use it to open up your airway so that any kind of mucus or sputum or phlegm being stored in the alveoli can just kind of push up to the upper levels of your bronchial or trachea and can come out. Okay, you can use it in partial drainage techniques. So we use it for our patients who have a lot of lung consolidation, a lot of phlegm being stored in their lungs. Now, the 3rd technique, we'll do this technique about 1 and 2. We'll do it 3 times, okay? And then we'll go on to a pillow and then we put a pillow right under our neck and we do deep breathing. So this can be done in a ICU setting, and it has helped to open up your lungs, open up the alveoli and cause more oxygen perfusion happen in a nice way, because all the things which is blocking your oxygen exchange around the alveoli wall gets cleared off when we do these techniques. Now coming off to pulmonary rehab. So we come and divide this into the 3rd chapter, which is post your recovery. We call it pulmonary rehab. We don't rehab a lung which is injured and inflamed. So people who are teaching deep breathing, please calm down. Your lung is inflamed, your lung is fibrosed, your lung is scarred, or your lung has become stiff. If that kind of a time when we start people to do deep breathing, our voluntary mechanism of our brain, the C fibers in the lung, will send signals to the brain that it's injured, and that will cause us to go into a more kind of respiratory failure position. So remember that your pulmonary rehab has to start when the patient is little better, little stable, and this is an 8-week program. So I had introduced it in the chapter of UK Dinnery and general physicians surgery, or it's called as a GP surgery, and outpatient surgeries for people with lung fibrosis, COPDs, and asthma, where we cover an 8-week schedule. And every week we look at how the patient's breathlessness score is, how his walking capacity is, how his hospital anxiety depression skill is, and how his quality of life is. We divide this chapter in an 8-week schedule where we look at their stress levels, their quality of life, so that they can be independent and return back to life without feeling breathless. And we look at how to improve their breathing patterns. Many of them who have had COVID-19 have faulty breathing patterns or labored breathing patterns. This kind of breathing patterns can be improved with the help of COVID-19 rehabilitation, which myself, Dr. Anjali, we've been running online all over the world and also in India. We have been doing it through telehealth sessions, and it has helped quite a few people go back to living a normal life. So you see in the picture, the lung is stiff and annoyed, is very worn out. The pulse oximeter will show oxygen sats, which are very low. In the second capacity, we see it's improved. And then in the third, the lung is happy. So for your happy lung, you need to do a COVID-19 rehabilitation, make the lung very, very flexible and very, very bouncy in nature. And for doing that, there is a tailored made program, person specific, and that is called pulmonary rehab. Not everybody knows about pulmonary rehab. I see a lot of YouTube channels and WhatsApp channels talking about pulmonary rehab. Lot of people who are not trained in pulmonary rehab scientifically are also running it. Do it under a trained person who's a cardiopulmonary physiotherapist. They know it, when to do, what not to do. That's my information, and all of you can reach out to me at 79816 3770 for booking your appointment online. And for acute care, I'm helping people to improve their oxygen sats when they're at home during the COVID-19 time. Then we have the moderate in ICU settings. Also, people can take my telehealth presence if they are not able to find a good physiotherapist in their hospital setting. And third is the pulmonary rehab, the COVID-19 rehab, which I'm anyways available online. Thank you. And any questions which I want to ask all of you would be on breathing exercise. Who's a physiotherapist? Who's somebody who's trained in the subject matter, and avoid forceful breath. So a lot of people are yogic asanas being taught in forceful manner. If you do a forceful breath, the lower basal segment of the lung where we have the problem with COVID-19, the other alveoli might just close with the pressure of breath. Please follow a consultant physiotherapist trained into cardiopulmonary. No other professionals on WhatsApp or on Facebook knows what cardiopulmonary physiotherapy means. It takes a lot of effort to understand what breathing pattern a person is in and what kind of breathing pattern a person has to be taught. Everything which has been shown on YouTube and Facebook, please avoid. Please see somebody who's more scientifically trained into a subject. Thank you. Stay well and do what's important for all of you. If you panic, you will slow down your breath and you will cut down the parasympathetic system to cause yourself to go into a sympathetic mode, which is more adrenaline driven and which will cause your heart rate to go up, which will cause your body to demand more oxygen. So if you calm down, if your body is rested, you can fight this too. Being at home, there is very less population or less percentage of people who would need an oxygen cylinder or oxygen bed or need hospitalization if you do the basics right. Okay, so pulse oximeter reading should start from day one. Okay, because we are having something called as hypoxia. Now, in those situations, I think what we can actually do is we will have to look at the pulse oximeter reading in a right manner. We should know the respiratory rate. We should know how a person's BP is, whether he's able to talk, whether he's feeling a bit dizzy or he's feeling little, restless. All these signs could be a sign that a person is going deficient of oxygen. But if you're hyperventilating and you are trying to store in more carbon dioxide, that again will cause your gases exchange in the alveoli to go into a havoc state. So all of you stay well, and you can always question me for any kind of questions you have, and then we can look into solving your problems. Thank you.